Welcome back to Living It Away, everybody. With Medicare's annual enrollment period just around the corner, it's time to have a conversation that goes far deeper than premiums, perks, or gym memberships. Today, we're breaking down how the plan you pick in October can define the quality and even the timeline of your care months later. Martha and Elliot Clopin join me now with more. Good to see you guys. Good morning.
Good morning. Good morning. Thanks for having us.
Okay, there's a lot of information to cover, Martha, but let's talk about Medicare annual enrollment. It's often emphasizes perks like low premiums and gym memberships, but what happens in a health crisis? A plan chosen in October can shape a patient's entire fight against a disease like pancreatic cancer coming. Right?
Exactly. So it's so important for people to understand how these plans work, because many times this is your blueprint for how your care will be handled. So a lot of people don't look at what's called the evidence of coverage, where it has more information about exactly how your plan will work. And that's so important when a person is diagnosed with like a fast-acting cancer like pancreatic cancer, because time lost can cause problems.
100%. I know we were talking in commercial break, we were saying that, you know, this is something that everybody needs to be aware of, right? And this is a topic of conversation that we should be talking about. You know, now many assume it's the agent's job to explain everything, but you highlight a critical gap between what agents provide and what beneficiaries truly need. Can you elaborate on that a little bit?
Yes, I would like to, because I will say Medicare insurance agents are great, but they have to do a lot of study and preparation to understand the features of the plan that they're marketing to you. But when it comes to a serious illness, in a short meeting to enroll you, they can't always explain and educate you about how Medicare will work for a specific diagnosis. So it's important for people to get familiar with the evidence of coverage, get familiar with calling the insurance company to learn about what to do if they have a fast-acting cancer. Sometimes people have an insurance card in their wallet, they're enrolled, but that's just the start. They need to understand how that card in that wallet works and how to make it work for them.
Right. You did mention education, and I feel like that's the foundation of actually getting to learn everything, is you got to understand what you're looking into. Speaking of education, for those wanting to start educating themselves, Elliot, what are the absolute basics that everyone on Medicare or their adult children or caregivers must understand, regardless of what plan is chosen?
Absolutely. So it's really important to understand your doctor network. And then you also want to know whether your plan is an HMO or a PPO.
Okay.
These are really important key tips to remember. So yeah, just a couple of things that you can keep top of mind to educate yourself about.
Okay, good to know. With annual enrollment approaching, what practical steps can people take to educate themselves and make truly informed decisions?
Right, so when you're going over a plan, you can ask the agent direct questions. If you get stumped on something, don't just nod along. Ask those direct questions and make sure you understand something if something's not so clear. You can also go directly to the source. You have Medicare.gov, which has a great plan comparison tool that you can do and compare plans. And you can also go to the Medicare and You guidebook as well, which is a great resource too.
Okay, and they can also reach out to you. What's a good website if anybody wanted to reach out?
Right, that's get2insurance.com, the number 2, get2insurance.com.
Get2insurance.com is the number 2. Thank you guys so much for being here. Okay, the conversation is far from over. Kelly is actually standing by with somebody who's going to talk a little bit more. Thank you so much. Kelly, back to you.
Hey, thanks so much, Mikey. Well, as we were hearing, empowerment through education is such a vital message. And Elliot and Martha, they love to bring that passion to life through a new partnership with the Sina Magowitz Foundation. And we're honored actually to have its founder with us right now, Roger Magowitz. Hey, Roger, thanks so much for joining us.
Well, thank you for having me.
Of course. I'm excited that we get to talk to all of you guys in studio today. But let's talk about the importance of Medicare education. Why do you believe that Medicare education does deserve such a strong focus?
Well, first of all, when a patient gets diagnosed with pancreatic cancer, time is the enemy. The patient is in shock. And quickly, one of the things that they start to think about is health insurance. And then they realize that they don't really know about their health insurance. So we want that patient to focus where their energy matters most, and that's on their diagnosis of healing. So that's why having somebody like Martha join our Medicare educational program, it gives the patients a lot more information than they ever had. And honestly, there is no other organization today out there that is bringing Medicare information. And we're very proud to have Martha from Hawaii give a little bit of aloha to the mainland as well as Hawaii, because a patient, when they get this diagnosis, they're really totally baffled. They're totally confused. They have so many concerns. They go on the internet. They realize that this disease could be life-threatening, and they really start digging very quickly for answers on how to build success for their future.
Yeah, and having that support and people that do know, what to do, what to look for. I mean, knowledge is power, and especially in situations like this, it can really make a world of difference and make such an impact in people's lives. So we're super grateful for, of course, Martha, for you. And if people want to learn more, what's a good website to go to?
SinaMagowitzFoundation.org. And the walk that we are bringing Martha to, a walk in Arizona. That walk is going to be at Mountain American Stadium on November 1 at 9 a.m. And also, to help the patients even further, Martha has agreed to do a Zoom call. It's going to be a Medicare health insurance open enrollment Zoom call, and that will be happening on October 6th. And that will be 1:30 Hawaii time for anybody local that would like to join and see what's going on with Medicare insurance.
Good to know, October 6th. And of course, we'll have all that info on our website, khon2.com. And of course, if you want to get in touch with Martha, my digital buddy, also get2insurance.com. We have their phone numbers everywhere on khon2.com. Thank you so much, Roger, for joining us. And again, thank you. Big thank you to Martha and Elliot, of course, for always being here in studio.